The act of moving one's body from a supine to prone position and vice versa greatly enhances one's functional independence. Rolling is involved with many daily activities, including relieving pressure on the skin and underlying tissues, dressing, and preparing to come to a sitting position. The process of learning to roll enhances one's kinesthetic awareness, which ultimately increases the number of movement strategies available to control other functions, such as dressing the lower body. Therapeutic techniques used to teach rolling rely heavily on biomechanical principles, including momentum, force transfer, and leverage. This section includes the following topics: the essential components of learning to roll and additional treatment ideas.
Kurt does not have triceps, so he has a difficult time elongating the overall length of his limb, but he still does that quite well by protracting the arm and leading with one elbow to try to increase this overall axial leverage that gives you the moment arm to help with a roll. He's also going to show how he's going to lead with his head and shows a lot of other different body mechanics that's going to facilitate this. So why don't you try that first? Notice how he's going to start with the center of mass is right near the sacrum. That's going to be the more area of inertia. Now, he's a little bit rusty on this, and we'll show a lot of good techniques trying to relearn this activity. I'm just going to give you a little bit of help from about right here. Reach out, make that left arm as long as you can. Reach, reach, and then back. All right, then come back to here again. Now reach out from this position. That's it. And then come back. Reach out again, and then back. Reach out again, and then back. Let's try that again now. The idea is lead with that left upper extremity. Get that as far to the left as you can. And the head leads and the trunk follows. That's it. Excellent. And then back. And it's very important on activities like this is to allow someone to get as far as they can into the activity and then kind of work backwards. You can get all the way to the roll, and then you can work backwards from the roll. Okay, come back here. Now reach out and complete it all the way. Now come back a little bit more. Now reach out and complete it. And notice this activity right here is this whole scapulothoracic protraction of the arm, reaching out, and leading with this left scapula elongates the thoracolumbar fascia here that helps pull on his pelvis, because the point of inertia is right near the sacrum. And reach again, and relax. Let's try one more. Just start that again. Excellent. And back. So when you first started to learn to roll, how difficult was it, or what are some of the problems associated with learning to roll?
It was really difficult. I couldn't get my hips over. I had to have my therapist cross my legs. I could just barely go like that.
So show me what it was like the first couple times you tried. I mean, just you would
go like that, and that's about it.
So the idea is to get the momentum of your arm swing.
Yeah.
To start, and then the area of your body that's most resistant to change of movement is right in the center of your body. So that's the area that kind of is got stuck. Why don't you show me now that you've been working on this for several months? Let me show you. Show me now what.
Okay. I need my leg crossed
You
now.
need your leg crossed to get started. Let me just show you an idea here what you're doing. This is really good. The first idea is that you really rotate your head first, because the head kind of leads, and then the body will follow. And then notice that you're using both arms as really levers to throw them as far out of space as you can get them. As far as you can get this lead hand out to here, you know, the greater leverage this is going to have to actually rotate you. The further your arm gets out in this direction as well, and you have triceps to support your elbow, it stretches tissue that's connected all the way down to your sacrum. So kind of push on me really hard. Push, 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 push. Now rotate the head, push. Now go back down. Okay. Push against, rotate the head, chin into the mat, push, and relax. Okay, one more. Rotate, push, and relax. Now, if you can combine that with the effect of momentum, that may just help that. Let's try that again. Let me straighten your feet out again for you. Okay, a couple on 3. 1, 2. Okay, this one, go for it. 3. Reach out. Reach, 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 reach. Good. And back. Now, you were saying before that crossing your legs, certainly crossing your legs helps that, right? So I think what happens when you cross your lead leg here, since the center of mass of the body is located right here, crossing your leg starts to kind of pre-tilt the pelvis in the direction you're going. And then once you actually work on extending this arm forward with the momentum and with rotating your head, the pull in the thoracolumbar fascia also comes back to the pelvis. So really, we're having forces from this direction and this direction that are all focusing on this center of mass of your body. So why don't you try that now? A couple of really good rotations. 1, oops, you didn't even need that, did you? Go back. Go back again. Okay, reach out. 2, reach. Okay, reach. Reach, good. And now back. Okay, reach, 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 good, good. And back. Okay, I'm going to uncross your leg now. Okay. Good, good. Reach, 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 reach. Beautiful. Okay. Hey, Jason, what I want to ask you to do is to roll over to your left any way that you feel comfortable.
Okay. Just come back.
And come back. Good.
Okay.
Why is that such an important movement? You were telling me earlier.
Well, one, it allows, I can go from there to sitting and then
Okay.
up into my chair. And another one is just the daily activity of dressing. Without that, it would be very difficult to get your pants all the way up.
Show me what you mean.
Well,
by
I
that.
would, I would I'd long sit and put my pants up as far as I could, and then to get them up all the way, you just kind of roll and, kind of pull them up and then roll the other way and, pull them up and then button them that way. So it's very functional for that.
And anything about any other reason, relieving pressure at night?
Well, at night when I was first injured, they teach you to express how important it is to roll, so you do relieve pressure on your, your hips and that type of thing. So at night, now it's not a conscious effort anymore. I will sleep, maybe starting on my stomach, and just throughout the night toss and turn and roll.
So you go
on my
through
back.
these toss and turns just subconsciously.
Right. Yeah, I don't even really, do it that way. So
Jason can roll very simply on level surfaces, and we're trying to come up with a way to actually offer him a challenge to roll. And one way to do that is actually rolling uphill. We found that offering challenges like this really forces him to focus on the various principles that are germane to the task, and in this case, rolling. So the first idea is, Jason, why don't you just roll any way you can up here, uphill. The first idea I want you to notice is that the more Jason relies on using momentum to actually begin the activity. When he's on a level surface, he does not have to use that momentum to pre-swing his arms, that's it. So this is an important idea about using momentum, and we're thinking about the angular momentum is created around a vertical axis on his body. Why don't you try one more time on that? Good. And the second idea, basically, he's going to use is to show how he really uses his protraction of that right arm. So why don't you reach out to me, okay, and really reach out with this arm, and relax, and back down. Now roll any way you want to, and just emphasize that protraction of that arm to increase the leverage effect of that, using that right arm to extend it. And then back, and reach out again. Good. And it's interesting, if you add a weight to this arm, as shown here, the task becomes even easier because the weight in combination with that moment arm really gives him an excellent torque advantage. So this can be used real early on when someone doesn't have the feel on how to roll, to actually offer manual resistance to the distal end of the limb or put a weight on this. And so now it's a very simple activity for him to roll by just using the idea of using that protracted upper extremity. And one more, and reach out and back down. And then once you can do this, you can combine various other activities. Very often when Jason learns to roll, he wants to find some surface on the periphery that's stable. And for example, if you want to use my arm as a hook, for example, this certainly allows him to use muscles like the pectoralis major and anterior deltoid and other muscles to contract and bring his trunk to his arm. Pull again and relax. Now back. Pull again and relax.
Persons with quadriplegia typically have marked or complete paralysis of their trunk muscles. Without trunk muscles, independently coming to a sitting position is only possible by substituting actions performed by other innervated muscles. Coming to sitting is an important goal for many persons. Performing this activity involves a sequence of relatively demanding movements, coordinated primarily by the upper extremities. Failure to achieve the sitting position can severely limit one's functional independence. Coming to sitting independently typically requires the ability to roll and to partially maintain the prone on elbow and supine on elbow positions. Teaching one to come to sitting relies on many kinesiologic principles involving the joints of the upper extremities. This section includes the following topics: 2 general strategies used to come to the sitting position, and breaking the act into its component parts.
And Kurt is going to show, he's going to roll first, and that's really an important component of rolling, is to get you to this position, supine and elbows. Once you get supine and elbows, then there's a couple strategies you can use to come to sitting from there. But the first idea we're going to show is actually getting supine on elbows from this flat supine position. And one common way to do this is to utilize the roll first. So you would roll over, get prone on elbows, and then use a technique to come back and end up supine on elbows. So the first idea is, or the first challenge here is to roll. So if you'd roll over to your left. Good. And if you could actually get up and put weight on both your elbows. And this whole idea here takes a lot of work, takes a lot of strength that you can bear weight through both shoulders like this. And now what Kurt is going to do, he's going to bear all weight on his right shoulder and slowly bring his left arm around and touch down on his left shoulder. And if we could just repeat that again, I want you to really concentrate on his right glenohumeral joint. It really acts as a pivot point through all of this. Now slowly come around and touch down on the left. I want to repeat that again. And it's important when you learn these, when you work on these activities, to break up these activities in their fundamental components. If you have an hour-long therapy session, set certain goals for yourself and just key it on certain components of this. And this component right here is trying to use the right glenohumeral joint as the pivot point and rotating your whole trunk around it. Now come back to me. And you can certainly resist this or assist this depending on what needs the person has. Okay, so now when we've accomplished the first important milestone to come to sitting is getting supine and elbows. He makes this look a lot easier than it really is when you first start. But at first, you have to learn to rock side by side. And this requires loose glenohumeral joints and enough control to hang over one shoulder and unload one shoulder. Right? So now, if I let go of him, he can have all his weight just on his left upper extremity. And once you learn this, then the idea is to throw this arm back as far as you can. Notice the range of motion that this takes as well. Also in the biceps, because it's stretched across both elbow and shoulder. Now you've got to bring your body weight over the right shoulder and momentarily hang on that position and throw your left arm back and then walk up from there. Now, this activity requires a lot of range of motion in the shoulders. The second activity, the second way to come to sitting, if you can go back to supine and elbows for me, please, is a little bit different. This method, Kurt's going to kind of do a semi-roll over to his right, pivoting on his right elbow and touching down with his left elbow. And he's just going to kind of walk around in a semicircle. The disadvantage of this technique, sometimes it puts a lot of wear and tear on the elbows. And when Kurt gets to about this position, the next idea is he's either going to use his elbow flexors or wrist extensors on his left, and he's going to extend this right elbow by using these more proximal musculature. Remember, he does not have any triceps here doing this. And this is an excellent example of using proximal musculature to extend this elbow joint as long as this distal segment is fixed. But if we just reverse that, if you don't mind, go back to about right here. So notice that he's actually attacking this from bilaterally. He's using elbow flexors, right, to bring his trunk in this position because he's actually hooking his distal form against his relatively immobile right leg. But the key idea here is that he's able to extend this elbow. And he's really going to do it by strong contraction of his anterior deltoid and clavicular head of the pectoralis major. And why don't you kind of do that as slow motion as you can, but right here. Can you back that up just a little bit? Good. And then come in again, up. And this shows an excellent example here of the anterior deltoid controlling the flexion and extension of this joint. Eccentric activity flexes it. Concentric activity, the anterior deltoid extends it. And how about one more? And then come all the way up to sitting from there. Excellent. Good. Angela's going to show several ways that she's learned how to come up to sitting from lying down supine. Give us some perspective of how long this took you to learn this, or how valuable is it?
I would say this, again, took me between 3 and 4, maybe even 5 months. It's very valuable. It's an important step to being able to transfer independently. And it's also important for being able to dress yourself. A lot of people, including myself, start with adaptive devices such as rails on hospital beds or bed loops. But as time goes on, you want to be able to do it just with no adaptive devices at all, because it's hard to have to depend on stuff.
And once you own it, then no one can take it from you, right?
Yeah.
Sure.
Yeah, so I can go from laying to sitting, whether I'm in a bed with rails, whether I'm on the floor, whether I'm on a mat. So then it just doesn't matter anymore.
Can you go back and do that again and leave that right elbow all the way straight? Like all the way straight. Just throw it behind you like you did. But leave it all the way straight. Now hang over that shoulder. This is the way someone without triceps often would do this activity. But Angela has a triceps, so she doesn't really have to worry about staying in hyperextension in the elbows. Great. So that's one method that's often used. Another method, again, starts supine and requires a roll. In this case, you roll, and instead of getting prone on elbows and coming back on supine elbows, you tend to just kind of walk your elbows around and keep both elbows on one side of the body and kind of walk in a long arc to come to sitting. I think this can be best demonstrated by Angela. And again, it requires that initial roll, which rolling is a prerequisite to coming to sitting, and coming to sitting is a prerequisite for transferring. So this technique often works well when you don't have the range of motion needing in your shoulders, the hyperextension. It takes a little bit longer, and earlier on it can be rough on the elbows. And you can certainly notice that Angela has very, very loose hamstrings, which does not at all interfere with this activity. Good. Reach. Good. Okay. How about if we stop right about there? This is always a hard part, isn't it? Because you have all the weight on your left shoulder. And if we go back to the mat again, now lift up. This is really an abduction motion of the shoulder from here back against all the weight of our upper trunk, and lift up. So this activity itself is very, very important. So you can actually start an activity like this and break it up into its functional components. We need to bear weight over a stable shoulder, and we need to be able to abduct the shoulder against all body weight. How about pull down a little bit? You all right? Yeah. Come up. Okay, you hold there and don't let me pull you down. Hold. Don't let me push you. Hold. Okay. Now, again, hold your trunk real stable. Hold. Hold. I'm trying to establish stability about this glenohumeral joint. Okay, how about if we keep going now like you're going to sit up? Good. Good. And how about right from there, if you would just kind of come back, and let's just back up with that task. Just kind of put both elbows onto the mat and kind of walk backwards. Just Just kind of reverse time with that activity. It's kind of like walking on elbows. That's it. Good. And now let's go to your right again. Kind of unload one and load the other. Good. Let's go back. That's it. Beautiful. Okay, and why don't you kind of take it from here? Good. How about this last little part of that maneuver? You do a really good job with that. How about if we bend again? Okay, this idea of getting this maneuver right here is driven really by triceps, but at first that can be weak, and this activity can be actually performed even without triceps as long as you have a well-developed anterior deltoid. But good. And kind of lead with your chin as you're looking to your right. That's it. I'm going to give you some resistance here. I'm going to come up, push. Okay, bring your chest all the way around to the left. That's it, good. Now kind of push up and relax, back. Push up and relax.
Transferring one's body to and from a wheelchair is one of the most useful abilities for achieving an independent lifestyle. Transferring not only involves moving one's body from one surface to another, but also includes preparatory tasks, such as proper positioning of one's body and locking the brakes of a wheelchair. Transferring from a wheelchair to a variety of other surfaces is an important step in many activities, such as bathing, toileting, transportation, and recreation. Although transferring without the use of external assistance is desirable, it is not always practical or possible. Even the ability to partially transfer oneself is beneficial. This ability can decrease the work on others, reduce the dependence on equipment, and improve safety and self-esteem. There are several approaches to teaching someone to transfer. Regardless of the approach, transferring requires balance, adequate range of motion, and the ability to move one's body in both lateral and vertical directions. This section shows several methods of transferring to and from a wheelchair.
Dan is about to prepare to transfer from his wheelchair into the driver's seat of his van. He will use a slide board to assist with this activity. Although Dan lacks the necessary shoulder strength to perform an effective sitting push-up, he is still able to complete this transfer. Notice how Dan twists his flexed trunk to facilitate the movement of his pelvis and lower limbs towards the driver's seat. Stephanie's going to transfer to the mat from her wheelchair using a sliding board, and she's going to lead towards her left side, which is her strong side that has good C7 function, and her right side has C6 function. So if you wouldn't mind doing that transfer and concentrate on some of the details of setting up for the transfer. So you first have to remove that footrest. Lock both brakes. And notice Stephanie's right arm kind of acts as a hook to stay with the wheelchair really uses her right elbow flexors and then uses her good C7 side to actually place the sliding board. And shows a good head-hips relationship there. Brings her head to her right, to her rear end gets to the left, and rear end has to actually be brought in front of the tire. And she must come forward to get properly placed on the board. Notice this right elbow has to be locked mechanically. She does not have triceps on her right. She really needs to, if I could just stay there a second, she really needs to make sure that this elbow stays locked by contraction of her proximal musculature. Okay. And then her left side has her triceps, so that her elbow can naturally lock that way. You're going to get your legs up now? Yeah. Your rear end's still on the mat some, is that all right? Mm-hmm. Requires really good stability on her elbows, which requires stable glenohumeral joints. Great. So leg management is a really important component of this transfer, and it makes it difficult when the sneakers kind of add to the resistance of the movement. Good. She has really good scapulothoracic depression to move her body like that. Bob's going to show his techniques that he's learned over the years to transfer. Why don't you roll your chair up and kind of get set up to do a transfer for us. First angles the chair in, locks his brakes. And Bob makes sure that his casters are rotated in such a way to increase the stability of the chair. And he's also worked his rear end forward to prepare for this pivot transfer. So he uses saliva to increase the friction between his palm of his hand and the surface, and does a great sitting push-up to bring his rear end up and over. How about, if you don't mind, just coming back again? This is really, whole emphasis here is elongation of his upper extremity, and at the same time keeping his elbow locked. And using great head-hips relationship, bringing his head down, bringing his rear end up, and the balance and control that he shows during that activity. Good. You want to try that again? And this time maybe you'll come all the way up over and then show us how you'd get your legs up on the bed as if you were preparing to actually go to bed and go to sleep. Notice the use of the wrist extensors on his left. Keeps his head low to unload his rear end. And the whole scapulothoracic depression is the key here. This activity right here. Great. Just stop right there a second. I just want to emphasize the balance that you have in this point. Can you just kind of put your hands in your lap? Okay. So a lot of this balance is not only Bob's been able to actually control certain spasms in his trunk, but also his abdominal region yields some stability. He's got a low center of mass, and he's actually has just a great sense of balance. And he also has a relatively tight low back that also gives him some kind of an anti-flexion torque to help control his stability. Great. Okay, now what if you were to bring your legs up on the mat? How would you actually do that? Bob has a lot of spasticity in his lower extremities, and he actually uses this to his advantage. He's now down on his left elbow. That's his central pivot. Excellent. And notice how he just pivots around his midsection.
You want me to go ahead and lay down?
Please. Kurt, how long did it take you to learn to transfer independently from the wheelchair to the mat?
Well, it was probably the period of time in and out of the rehab hospital, probably 4 to 5 months before I could transfer independently.
And when you left the rehab center, could you do it by yourself?
Not completely, no. I was using a sliding board, and I believe I could get onto a mat or the bed most of the time, but I couldn't pull my legs up at that point. So it was kind of a learning trial and error after that point.
You eventually got better at it. And how about show us the maneuver now, if you don't mind?
Sure. Just put my chair at a slight angle to what I'm transferring onto. I back up a little bit to get the caster wheels forward. Now I have caster locks to just make the front of the chair a little more stable. I lock the brakes. Twist around a little bit.
Show me that motion again there, that little twist
The
motion
twist?
you had. You tend to hook your right arm around that
Yeah, I hook my one arm. Yeah.
and rotate kind of
Yeah,
your head
rotate a
this
little
way
bit.
and your rear end slides the other way. Okay.
And I keep one hand on the wheel.
How about, if you don't mind interrupting here, notice the left arm, how he has this nice hyperextended, stable left elbow, and the same thing with the right. And when he keeps that hyperextended elbow, he's really going to add a very powerful scapulothoracic depression at the same time, and he's going to lower his head and show an excellent sitting push-up. And then the next idea is getting your legs up on the bed. That was difficult at first, huh?
Yeah, it was very difficult. Your legs are kind of heavy, and if you have shoes on there, they like to stick to your chair.
Notice the excellent short sitting balance he has, excellent well-developed left wrist extensors. And notice, why don't you slow down on this just a little bit, and keep going, but slow down. Notice how Kurt's going to push down as far distally on his leg as he can to increase the leverage. It's very difficult to actually get the knee and hip into extension from this position, but go ahead and push your leg out. The idea is to have your push as far down towards the shoe as possible. There's another sitting push-up. Good. But do me a favor and lie your head back down on the pillow, and I'm going to ask you to repeat this activity. So if you'd come up to sitting any way you can, and then get back in the wheelchair.
And if I have a chair next to me, I'd like to grab onto the handrail with one arm. And sometimes I can pull myself up completely like that.
But if you don't mind, if you can go through that one more time, just a little bit slower.
Sure.
Notice what's going to happen. He's going to use that excellent tenodesis function he has on his right wrist. He keeps his wrist hyperextended, maximally elongating his finger flexors, and he uses that passive tension to maintain the PIP joint's inflection. Now, when he stabilizes the distal part of his upper extremity, he's then going to contract his right elbow flexors, his right anterior deltoid, and he's going to time a push with his left upper extremity. And once he gets to this position right here, he's going to throw his left elbow behind him and hang over his left shoulder and come on up. Now, this is all done without any tricep function whatsoever. Do you like getting your feet on the wheelchair or the ground? Or does it matter?
For me, it works better to put them on the chair. Again, I do have caster locks on the chair, and that helps the front end stay more stable when you've got weight on the front and not on the back.
Can you hold this right here? I just want to point to the extremely well-developed wrist extensors that you have on your left. So much more on your left than the right. Okay.
Pants lock on the brake. Some are a little more graceful than others.
That's excellent. Jason, would you transfer on the mat for me, please?
Sure.
What I do is I use my legs to get my body out. So I bring myself down and actually bring my hips out before I transfer. It's a process that works for me of kicking my legs and my body out. Sometimes with my spasms, it can help kick them out to get my hips out.
So you really use your wrist extensors there to do that, don't you?
And then I turn also, using my handlebars to get my hips out on the very edge of my seat.
Really challenges your short sitting balance and your short sitting push up. Get your head down and bring your rear up, end up. Excellent. How about if you could just center yourself on that mat if you would. Good. Once you do that activity, then go down like you just did, then come back up. Now push straight up. That really is an excellent use of that transfer of the iliotibial band from the posterior deltoid to the triceps to give you that elbow stability. Great. How about now, can we do the return move now? Can you?
Okay. Is there any particular way you would like me to sit up?
Any way that you feel most comfortable.
Okay.
and then we'll just transfer back. So you make sure that your feet are secure on the ground or on the foot plates.
No, I have them on the foot plates because then it's like your thighs are at the same height as your seat cushion. That helps a lot, especially in uneven transfers. This one's pretty much level though, so it might not make a difference.
Right.
Floor to wheelchair transfer. A small percentage of persons with quadriplegia are able to independently and safely transfer from a wheelchair to the floor and return. This highly skilled task requires tremendous strength and control of the body and flexibility of the lower extremities. Due to severe loss of motor and sensory innervation, transferring to the floor from a wheelchair or returning can potentially cause bodily injury. This activity should only be attempted under the direction of qualified health professionals.
Jason is going to show a very advanced transfer, the floor to chair transfer. And it really is unique that he's able to do this with his level of function. He has function down and including C7. He's going to show a lot of very interesting kinesiologic principles, and particularly the head-hips relationship that he's going to explain, and just his ability to use his balance, and just his ability to actually problem solve. This transfer, when you get back from the wheelchair to the floor, is this a real practical thing that you use at home?
For myself, it is. I'm very active and I do a lot of things. And I probably average once a week on the floor, whether it's falling, kind of sliding off a couch or out of bed with a spasm, or when I'm transferring, or just not setting myself up to transferring correctly. Or sometimes, going along the sidewalk, I hit a crack and might stumble out or whatever. I mean, people trip walking, I view it as the same thing. So. I'm glad I can do it, and it definitely increases my independence. What I do is I bring my knees up to my chest like this because I'm not able to drag my whole lower half up into my seat. And when I was first injured and first learned some therapy, this transfer, I took my cushion off my seat, and I would, that would lose 2 inches on my seat, and then I would sit that on the ground and sit on that and gain, 2 inches there. So it was about a 4-inch gain. So the lift didn't have to be as good. So what I do is, like I said, I bring my knees up to my chest and then bring my left one up. And the technique, or the problem I first encountered when doing this transfer with this, was this left knee would just flop out when I would try to go up. And what would happen was I wasn't able to extend my arm enough to get my butt all the way up in the chair. So what I kind of just play around with my foot a little bit and twist it, and it seems to be staying there pretty good. Another thing is I kind of lean my chest on it when I go to make the initial transfer. And with my knees up like this, one thing I'm fighting is my back and head to want to fall backwards. It's kind of an odd, tuck position under the muscles, I suppose, to hold me forward. Sure. And the way I kind of fight that is, if you look at my right hand, it's kind of stuck in the spokes, and I'm, on the chair. And so another little technique I developed over just doing it several times with my left wrist, I keep it straight, straight out like that.
So your wrist is not going to collapse on you either way. You're strong on both sides. It's your
Right.
C7 and C6 function.
Right. So, and what that does, it just adds a couple extra inches, with the lift. And when I give it a shot here, and what I try to do is just keep my head as low down, as I can. And then this right arm, I want to try and pivot my elbow as straight up to the ceiling as I can. It's much more stable and controlled for me to do the actual lift. So we'll give it a shot here. And as you can see, my head, I'm in total control, and my head is staying down, and I'm able to keep my left leg kind of up against my chest, and that keeps that from falling out. And now I'm right on the edge, so if I just give a little quick pop, it gets me in there like that. And then now I just have to kind of put my legs up underneath me, to lean on my chest, and then I'll just lift up like that, and then I just tuck it in and ready to go.
That takes incredible strength.
This video has focused primarily on technical concepts related to improving movement and function following a spinal cord injury. Maximizing one's ability to function, however, requires more than just technique. A strong motivational drive, coupled with a positive attitude and a willingness to work hard, are also important factors. Ultimately, this drive must come from within the individual. Family, healthcare professionals, and others often serve as catalysts to help one develop this level of desire. We would like to share with you some comments and insights from the people you have seen in this program. Their own words are the best testimony to the desire and results that can be achieved in living with a spinal cord injury.
I can remember the first time, trying to just sit on the edge of a mat and you don't even want to move because you're afraid you're going to fall over, and or working on dressing or something like that, and it takes you the whole session of an hour just to get on the mat, get your legs up there, and you have 1 foot through the the foot of a sweatpant, and that's it. But then the joy of it is when you look back and you think, oh, a month ago I had to have somebody stand here and they had to put the sliding board underneath for me or something like that, and now you can do the sliding board yourself, or you're doing the transfer without a sliding board and you only need a little assistance. And that's the joy of it, when you can see your own progress.
Well, when I first was injured, I focused a lot on being hurt and on a negative aspect on my injury. I always focused on the things I couldn't do instead of focusing on the things I can. It supports me. I have lots of friends that support me. I have a great support system with my with the VA hospital, with my therapist and doctors there, and social workers that's inspired me to become a social worker and do the work that I'm doing today.
Some of my greatest accomplishments would be getting out of an electric wheelchair, push a manual wheelchair, and that got me into wheelchair sports and independently transferring.
Come on, Dan. Get out, break free, Brian.
I've always believed that you really can't control what happens to you in life, but the one thing you can control is your attitude and how you react to what happens to you in life. And I've been positive from the start, so everything I can do will help me to accomplish those goals. I mean, I guess I'm still on a journey, a rehab journey, So I'm not sure where the end is, but I still have a lot of obstacles to deal with.
If you do enough physical activity where you're going to keep your muscles strong, it's going to make transferring easier, it's going to make pushing your chair easier, just makes everything easier if you're at the maximum you can be. I've been disabled for over 20 years now, and I'm still finding new ways to make things easier to do. And don't be afraid to try things. You may fall on the floor once in a while. I know I certainly have. But you get back up. Sometimes you need help getting back up. But just keep your chin up, keep trying. Life's not so bad.
One of the big things of independence has been to get a van and being able to get into my van in and out by myself and be able to go places on my own. I've gotten stronger and still am getting stronger every day, but I have a long way to go to keep a healthy lifestyle of staying as strong as possible, because I realize so much depends on your health and your strength.
I think it's important to know what you can do and try to maximize what you can do to make yourself a better person or be more effective. I want to do everything that I possibly can do to have a great life. And this injury is not going to hold me back. It's the last thing I want to have happen.
For me, it has to be when I reach the level of functioning, of being able to say that I was independent. And that came from working with occupational therapists and working with physical therapists. They worked closely with me and told me that I could do things that I couldn't picture anyway, that I was going to be able to do that activity. And it's kind of telling. A number of times recently I've had people, family members, say to me that they forget occasionally that I'm disabled. And then I think back and I go, oh geez, I kind of forgot too.